All right, thank you for joining us. We are here for Experience Public Health, our fourth in a series of National Public Health Week events. Thank you for taking the time. I am Tracy Seward. I'm going to be your moderator for today. I'm the Senior Director of Educational Pathways and Undergraduate Education here at ASPPH. With me today, I have a great panel of speakers. One is Tony Mancuso, who is the Communications and Outreach Senior Specialist at AAMC. Got Jeff Oxendine, who is the co-founder and president of Health Career Connections and the author of You Don't Have to Be a Doctor, Discover, Achieve, and Enjoy Your Authentic Health Career. We have Janice Blake, who is the senior director in the Office of Workforce Development at the New York City Department of Health and Mental Hygiene, and Heidi Pfeiffer, who is a public health advisor for the CDC. With that, I'm going to turn it over to our first panelist, Tony. Thank you.
Hi, everyone. Definitely good afternoon to everyone. My name is Tony Mancuso, and I lead communication efforts for the Summer Health Professions Education Program, better known as SHPEP. Give me one moment as I'm getting my slides up, but I definitely want to, tell everyone that this is definitely a great opportunity to learn more about a bunch of amazing programs here today. That being said, let's go on ahead and get started. One thing about our program that I really like to share is that over 65% of our scholars that apply to medical and dental school are accepted. But what is it? What is SHPEP? Well, SHPEP is a free 6-week summer enrichment program for college freshmen and sophomore students who are interested in the health professions. And our program is truly committed to strengthening the career development of underrepresented and economically disadvantaged students while preparing them for a successful career in the health professions. Students, of course, can gain experience in medicine, dentistry, nursing, optometry, pharmacy, physical therapy, and public health. And they can gain this experience at any one of our 12 program sites listed here on the screen, which are Columbia University, Howard University, Rutgers, the State University of New Jersey, UAB, UCLA and Charles R. Drew University, University of Florida, University of Iowa, University of Louisville, University of Nebraska Medical Center, UT Health Science Center at Houston, University of Washington, and last but not least, Western University of Health Sciences. Now, what are the benefits of this free program? And tell me what free means, right? Well, each student who's accepted will receive housing, meals, a stipend of $1,000, and travel assistance from their home to any one of our 12 program sites and back home. But most importantly, they'll gain guidance from current admissions deans, health professionals, students in health professions programs, and our alumni base of over 30,000 about how to pursue your profession of interest. So what happens during SHPEP? Well, students will gain academic enrichment in the basic sciences and math, participate in career development activities such as resume building or mock interviewing, learning and study skills workshops, which will help you maximize working in individual and group settings, exposure to clinical settings, which is what's typically needed to matriculate into a health professions program, workshops in financial planning and health policy, and IPE, interprofessional education. Essentially, you get to learn how each of the health professions work collaboratively with one another. To be eligible for our program, you must be a high school graduate and currently enrolled as a freshman or sophomore in college, have a minimum overall college GPA of 2.5. I always tell students if grade is achievable, good enough is no longer acceptable. But yes, we do accept students if they're at a 2.5, even in some cases, maybe even a little slightly below, but 2.5 is that standard right there. And of course, you need to be a US citizen, a permanent resident, or been granted DACA status by US Citizenship and Immigration Services, and you could not have participated in the program previously. Essentially, we want everyone to experience SHPEP. Of course, there are other factors for consideration, and they include that a student either identifies with a group that's racially or ethnically underrepresented in the health professions, they come from an economically or disadvantaged background, or they've demonstrated an interest in issues affecting underserved populations. Now, I want to pause right here and say that our program sites engage in what's called holistic review, which means we're looking at more than just that number, that GPA, which is why we want to know, you want to know your distance traveled, we want to know the type of impact you want to make in the community. So it's really important, critically important for you to write a compelling personal statement and a really strong letter of recommendation from your letter writer. Now, it's one thing for me to tell you and give you advice on personal statements and letters of rec, but I'd rather you hear from some of our ambassadors, which are alumni over the program.
Hello, everyone. My name is Jasmine Lopez, and I'm an SHPP ambassador. I was in the program with Rutgers, New Jersey Medical School in the summer of 2020. I'm returning to speak with you all today about being successful in writing your personal statements as a SHPP applicant. I know that this part of the application can be challenging, especially if it's your first time writing a personal statement. The main advice I give applicants is to be genuine and to stay true to yourself. Don't try to write your personal statement as someone else or trying to fit a mold of what successful applicants may be. Your story is so important and it matters. So be true to yourself and let yourself shine, because I know that you all have so much going for you and have such amazing life stories to share. I would advise that important aspects to cover in the personal statement for SHPP are why you're applying to the program, what your motivations and future goals are and how they align with the program, what you look forward to learning and experiences to gain, what serving minority populations in the healthcare professions means to you, and how your personal life experiences have brought you to this point of applying to SHPP. Throughout all of this, I advise that you stay true to yourself, because I don't believe in molds for how you should tell your own personal story and your beliefs, experiences, and goals. Keep in mind that while the personal statement may seem scary and daunting, it's simply a means of sharing with SHPP who you are, your life experiences that have brought you to this point, and why SHPP aligns with your personal goals and values. Only you know how to express yourself and how to genuinely share your story. I believe in you all, and I know you'll all do great. Believe in yourself and speak your truth. The right opportunities for you will appreciate your uniqueness and all that makes you you. Thank you so much.
And last but not least, I'd like to have another one of our ambassadors talk about how to request a letter of recommendation.
Hello, everyone. My name is Jada Roberts, and today I'll be talking to you all about how to request a letter of recommendation. So, before you even request a letter of recommendation, it is important that you build a relationship with that person. Ways in which you can build a relationship will be one-on-one interactions, group interactions during office hours or tutoring, and as well as contacting them via email to reach out. What you would like to do is contact them, state who you are, what you are trying to do, and how they can be of assistance to you during that time, which will be asking for a strong letter of recommendation. So if I was asking for a letter of recommendation, I would contact them via email or in person saying, "Hi, my name is Jada Roberts. I am a student in your honors class this semester, and I am applying for an internship this summer." Obviously include more details than that, but ask them, "I wanted to know if you would be willing to write me a strong letter of recommendation." Typically, the professor will let you know if they can write you a strong letter of recommendation. They'll be completely honest with you. If they cannot write you a strong letter of recommendation, it is important that you weigh your options and consider getting a different letter of recommendation from someone else. Also, you want to make sure that you ask for this letter of recommendation a month in advance, at least a month in advance, before the deadline to actually submit the letter of recommendation. You have to give the professor or faculty member time to actually write the letter, include all of the details that you need to have included, and then be able to submit it on time. You also want to make sure that before asking for this letter of recommendation that you have your CV or your resume handy in order to give to the person who is writing you this letter of recommendation, which gives them a background about your endeavors and your goals, what you have accomplished thus far, that can help them support their statements about you. You also want to let them know everything that they have to include in that letter of recommendation that is required by the program you are applying for, the job you are applying for, etc. After you have had them submit the letter of recommendation, make sure you thank them. Make sure you thank them and let them know how appreciative you are of them taking the time out and the effort to write you this letter of recommendation and how much it means to you. After you apply for the program, the letter of recommendation is submitted and you get accepted into the program. Just do a follow-up and let them know that you were accepted, just to establish that further relationship, so that come time for you to apply for a new position or apply for a different program, they will probably be willing to write you another letter of recommendation because they know who you are, you have built this relationship, and they were of assistance to you. So good luck.
With those two videos, there were definitely a lot of transferable skills that I feel that you can not only use for this application for SHPEP, but some of the other applications and the other internship opportunities or experiential learning opportunities that are out there, especially the ones that are on this call. Of course, our application will open November 1st, so definitely stay tuned. Visit our website to learn more, shpep.org, and thank you for having me. I'm now going to turn it over to Tracy to lead us over to our next presenter.
Thank you so much, Tony. That was great. Our next presenter is Jeff Oxendine. I will share my screen.
Thank you, Tracy. I'm Jeff Oxendine. I'm the founder and CEO of Health Career Connection, also a former health executive and former faculty member and associate dean of public health practice at UC Berkeley School of Public Health. I want to first do a shout out for the Summer Health Professions Education Program, Health Career Connection, and me in my role at UC Berkeley have seen dozens of amazing students who've come through that program and have gone on to be really successful health professionals and public health professionals. In fact, just earlier today, was speaking with one of our alums who was a Health Professions Education Program alum who is also went to HCC and now is at Brown University getting his master in public health. But what I'm going to talk to you about today is Health Career Connection. We inspire and empower the next generation of diverse health leaders and professionals. Next slide, please. Oops. And HCC, this is our 33rd year. We are all about empowering undergraduate students and recent graduates, primarily people from underrepresented backgrounds and under-resourced communities, often first in their family to go to college. We're all about giving life-changing, career-launching opportunities. We've had 4,600 alumni go through our program who are successful leaders in public health and medicine and behavioral health. And we are about improving health workforce and diversity within the regions that we serve and nationally. And there are hundreds of employers out there who are excited about all of you coming into the field. And so we're all about connecting you as part of the Health Career Connection, connecting you to your authentic health career and connecting you to employers and graduate school partners. We're going to help you to get jobs and advance in your public health career and graduate education journeys. Next slide, please. So what we do is we work with students. We support you to have full-time paid summer internships and work on priority projects. Public health is our top priority, but we also have projects that are in healthcare, behavioral health. We're about advocacy, so people who want to be change makers, like I know many of you are, and even have internships in the life sciences. We want people who want to be transformational leaders, people who want to be professionals too and get good technical skills, but who see themselves as being leaders to advance health equity and racial justice and health improvement in our communities. Next slide, please. And so we do this all throughout the country. We have paid full-time 10-week summer internships that run between usually late May and early mid-June to mid to late August. And we have cohorts, regional cohorts of students who come from all different schools in a region to come together and be part of this experience with others who have similar passions and similar goals. And we do this, you can see all throughout California, in the Northeast, with New England, in the New York and DC area from North Carolina, as well as in several Midwest cities. We also have virtual internships. So you can do an HCC internship either in person, hybrid, or virtually. And if virtually, you can be in any state in the country and participate in our program. The next slide, please. In addition to our paid full-time summer internships, we have a virtual health equity scholars program. We created this in the first year of the pandemic, so this will be our 4th year. And this is a program where people can be part of HCC virtually. It's a 20-hour-a-week program instead of a 40-hour-a-week program, and it's 8 weeks. So somebody who's going to summer school, who's studying for the MCAT, who's taking care of young siblings or doing other responsibilities, other jobs, you do the program and be part of HCC. You get all of our educational programming, our career development. We have a lot of workshops around health equity and racial justice. And we also have you do team consulting projects, working with actual organizations to work on projects that are focused on health improvement and health equity and population health, building healthier communities. Next slide, please. And so throughout both of our programs, we have a really proven comprehensive educational career development, leadership development program. It includes the full-time placement where you learn by doing, which is a big part of what HCC does. But we also really focus on hands-on experience working within HCC, building skills, those kind of things. So the first part is getting as much exposure and experience to what's possible for you in your career, and then really getting the hands-on, seeing what it's like and seeing if what you think you want to do is what you actually want to do, which is really important. Also in our internships in our Health Equity Scholars Program, you're making an impact on community health while you're in the program. You don't have to wait until you're a health professional already. We also have mentorship from where you do your internship, as well as HCC staff and alumni and leaders in the field. We build community within each of our regional cohorts and across the HCC country for all the people in our programs, so that you can feel a sense of belonging, build your network, build your confidence and your agency to become a health professional, and have colleagues who are going to be part of your network throughout your life. We have a term called, it's either network or not work. And so we teach you networking skills, and we put you in the network with our fellow students and alumni and partners to really be successful. We work on workshops to build your skills. You learn valuable hands-on skills, including things like cultural linguistic competency, project management. We also have you work on your career. The book that Tracy mentioned that I wrote, everybody gets a copy of the book, and you go through all of the steps, the chapters of the book to help you come out the other end knowing more what you want to do. And we also have graduate school partners, and Tracy comes and gives a presentation on getting into public health graduate school. We work with our graduate school partners to help you prepare for medical school, public health school, or other careers that you want to go into. The next slide, please. And it works. We've been doing this for 33 years. We have 4,600 alumni that are from the communities that are most underrepresented. The host organizations are happy with their experience, and we love this one. 70% of our interns either receive a job offer or extend their internship with their host organizations. And we have a range of host organizations all across the country. The next slide, please. Here are some of our alumni that are notable. And you can see we have leaders in healthcare, in public health, in behavioral health. Ike Majay is the CEO and president of USC Arcadia Hospital. He was just named this past weekend one of 149 Black healthcare leaders to watch and know in 2023. Denise Fair-Razzo is the chief of the Detroit Public Health Department. And we have faculty members. We have Ivodi Lamon-Roca, who's a psychiatrist serving underserved communities, as well as an advocate. So you'd be following these folks' footsteps. And guess what? They'd be reaching back to support you. Next slide, please. And as I mentioned, we place our interns in a wide range of organizations. These are just some examples. You can see we have leading hospitals, health plans, community health centers, public health departments, life sciences companies. So what we do is you apply to HCC. We then work really hard to fit you with a match of an organization that's aligned with your unique talents, passions, your goals, and your lived experience, and with what they're looking for. So that's how we get to that 70% of people get a job or extended internship. Next slide, please. And then 82% of our alumni go on to complete a graduate degree within 10 years of their HCC experience. And it's 10 years because we actually encourage people to work before they go on to graduate school, and they get a job through HCC to do that, or they're going into something like medical school or a PhD program or something that takes many years. But we have all these different medical school and public health school partners that are reaching out to you. We have our workshops with them. Their financial aid people come to you to talk to you, to say about how you can pay for your education. Columbia School of Public Health even has a graduate, has a scholarship for HCC alumni. So we've got a great set of partners to connect you to. Next slide. And so like Tony's application that's going to be available this fall, ours will be available as well, probably in the late September, early October timeframe. We're at healthcareers.org where you can go and learn more about us. But we hope you'll apply for HCC and join the HCC family, and it'll be your pathway to your authentic health career and making the impact you want to have on health. Thank you all very much.
Thank you so much, Jeff. All right, up next, we will have Janice. Let me pull up your slides. Denise, can you hear me and see the slides?
Yes, I see them in presenter mode. Can they just be in?
Oh.
Perfect. Thanks so much.
Right,
Good
yep.
afternoon. No, thank you. Good afternoon, everyone. Happy Thursday. My name is Janice Blake. I am the Senior Director of the Office of Workforce Development at the New York City Department of Health and Mental Hygiene. For the past 13 years, I've had the distinct pleasure of working with public health students as they serve as interns here at the New York City Health Department. At the New York City Health Department, we have a range of public health internship opportunities in our portfolio, and I'm happy to share some of these opportunities with you. My hope is that after you're hearing that, I will be able to see you here. Next slide, please. So this is an important quote for me and for my team here. This has been our guiding principle. We actually have been training future generations of public health here at the New York City Health Department since 1961. And we even have t-shirts that say that. And our internship programs basically serve three goals: to orient students to the principles and practices of public health, to broaden the students' concept of public health by increasing their awareness of the challenges, the needs, and the career opportunities in the field, and three, to assist the health department with recruiting skilled professional candidates with proven potential. Sometimes our interns do join us as staff, and that's always what we call a confetti moment. Next slide, please. We start early. Again, the slide before, we talked about preparing staff, and we start early. So we have a pre-career program where we have our Public Health in Action program. This is one of our newer programs since 2019 or 2020, where we introduce public health to New York City high school students. We go into the schools and we provide a 3-series workshop to high school students on what public health is, how they can become an actor in their own community, and how they can become an advocate for their public health, not only in their school community, but in their home community as well. The other program we have here is our PHCE, our Public Health Career Exploration Program, also a quite new program. This started in 2021 in the height of the COVID-19 pandemic. The PHCE, or the Public Health Career Exploration Program, has an emphasis on engaging youth from communities highly impacted by COVID here in New York City. It is a paid internship program, and it usually occurs during the spring semester. So right now we're hosting cohort number 3. For our Public Health Career Exploration Program, you do not have to be attached to academia. This is actually for students who are in high school or, again, between the ages of 16 to 24. And again, you do not have to be attached to academia for this program. That is actually the focus of the program. Next slide, please. Then we have early career programs. By now, you're getting the gist that we just believe that internships are just really, really important. And another set of programs that we have at the agency is our HRTP program. Again, that's been at the agency since 1960. And HRTP caters to graduate and undergraduate students. We have 3 opportunities for students to join us with an HRTP. We have a summer program, a spring, and a fall program. The summer program is our biggest program with over 500 applications and a summer curriculum. We ask that our students are paid. We ask our preceptors, which are staff here in the agency, to pay the interns. We ask that students work about 10 hours per week in the school and during school time, and up to 35 hours per week during the summer. HRTP, again, is open to graduate and undergraduate students. Our New York City EPI Scholars Program is a graduate student program that is only available for students in the summer, and it's ideal for those who've completed 1 year of an epidemiology, biostatistics, or surveillance program, master's program level, and who attend one of our 21 partner schools. EPI Scholars is a summer-only program with a stipend of about $8,000 for the summer, and it is full-time, 35 hours per week in our New York City offices. Applications for EPI Scholars are open from January 15th through February 15th each year. EPI Scholars has been around since 2007. Another program we have here is our Public Health Volunteer Corps, our PHVC program. We call that a postgraduate opportunity. It's open for students who may have graduated from undergraduate, their undergraduate institution, and for whatever reasons did not find the right internship or did not have an opportunity to participate in an internship opportunity. And the Public Health Volunteer Corps allows you to do that. You're working on a public health project with a preceptor. It is unpaid. It's a little less structured than our HRTP program, but it's a similar project. Unstructured in that you can work a little more hours. Unstructured in that the projects can be short or long term. Next slide, please. So I can tell you, I'm the director of the program, senior director of the program. I've been here for 13 years, and I can say it's great, but is it really truly so? And so I'm just going to take a pause and let you hear from some of our HRTP interns what their thoughts are. Tracy, could you play that video for me, please?
Man, where do I start? I've had a really exciting career so far. I'm still at the beginning of it. And never think that this is something that you can't do just because you don't yet have a graduate degree or you haven't applied to grad school or you haven't taken a GRE. Because one great thing about HRTP is that it is open to undergraduate students. Because you might be an immigrant or you might be in some way part of a marginalized community, HRTP does a great job of being equitable in its practices in terms of selecting students.
When asked the question, do you have to be a public health major to apply to an HRTP internship, or what would be the best major for an HRTP intern? I would really say that there is no best major, because the work of the health department spans so many different areas, working with data, logistics, and management. Be open to learning new skill sets and using your skill set to apply it in maybe a different way than you might have originally seen it going.
You know, I'm a native New Yorker myself. I grew up here in Brooklyn. My family lives here. Most of my friends live here. So for me, it's kind of personal working here to be able to, you know, try to help the communities that I grew up in, the communities that I know.
So what made me apply to the HRTP Public Health Internship Program was just having the opportunity to work alongside public health professionals on current relevant public health issues. I thought there was never going to be a program like that available, but once I came across the program, I thought it would have been a great opportunity to just apply and be part of it.
Just being in a city, just being able to hop on the train and observe that 20 minutes away is one of the greatest educations you can get. And so I think being in New York City, it in and of itself is part of the education of public health.
And on day 2, I was called into a response in Washington Heights in Manhattan for Legionnaires on my second day.
And at this internship, you're going to do real work. In some internships, you're like scrolling through articles and reading journal articles, and it seems like you're kind of more there as like to do busy work. The work that you do as an HRTP intern definitely impacts the lives of New Yorkers, and that's definitely not something that every internship can say.
It's incredibly important to have a space to literally translate and exercise the skills you're learning in that program, in that classroom, in real time in the field. And an internship offers you like that real hands-on experience that you're going to need before entering the workforce.
And coming out of this internship, I've learned so many things, not only as a public health professional, but as an individual.
It's one thing to learn concepts in class. It's another thing to be out in the world and actually, participating. I was pretty sure I wanted to be in public health. Now I'm definitely sure I want to be in public health.
Since 1960, HRTP has offered internships to students to learn more about public health. HRTP accepts undergraduate, graduate, and professional students. There are 3 sessions and 3 opportunities to apply each year. Students may apply for placement in our spring, summer, or fall sessions.
Thanks, Tracy. Next slide, please. So in summary, we are the Bureau of Public Health Training and Information Dissemination, the Office of Workforce Development. And again, we have pre-career high school programs, we have early career programs, and we also serve as host for various different programs that you see there on the screen, like, for example, the Ladders for Leaders program, our Public Service Volunteer Corps. We host PHAPs, which you'll hear about in a little bit. We host AmeriCorps, we host Urban Fellows, and a slew of other programs. We also have a preventive medicine residency program. Also, since 1960, we host medical students and medical residents who want to spend some time here learning about public health in New York City. Next slide, please. I always challenge the students that I encounter to consider internships here at the New York City Health Department or just anywhere. I encourage you to consider an internship in governmental public health organizations such as this one, or in organizations that you feel passionate about. Each will provide you with a rich opportunity to understand and engage in public health work and determine where your public health path will take you. As we try on clothes, as we try on shoes, as we try on so many other things, internships are an opportunity to try the job out, to fill your skills basket and develop a professional tool basket. Like you go to the supermarket, I encourage the students that I encounter through HRTP to think about an internship as the opportunity to fill your skills basket or your shopping cart with the skills with the folks that you encounter at your site. Next slide, please. I'm thanking you. This is my contact information and our website where you can learn more about the internship programs at the agency, as well as current job opportunities, or review our promotional video. Once again, it's on YouTube. Thank you. I'm all set, Tracy. Thank you.
Thank you so much, Janice. That was great. And our last presenter is going to be Heidi for PHAP.
Hi, everyone. Thank you very much for all the presenters that came before me. I wish that everything was available for me to look at when I was at your guys' age right now who are on the call. It's amazing what's available out there for people to really excite you and get you invigorated about working in the field of public health. So what I'm going to do today is talk to you a little bit about the work that we do here at CDC. Let me share my screen and show some slides really quickly. Give me 1 second. There we go. Okay, outstanding. If you can just someone confirm that you guys can see my slides, that would be great.
We can.
Okay, great. I'm losing my little here. Let's put you down here.
It's not in presentation mode though yet.
Gotcha. How's that?
Or I see the presenter mode.
This is an example of someone having to be flexible. And this is exactly what this is all about when you work within the field of public health. You have to be flexible. And this is not letting me go here to.
I think if you go to display settings.
Say that one more time.
At the top at the display settings, I think that's.
Outstanding. Well, let's do this. Let me, if I go back here really quickly. Tracy, we're going to do both slides if that's okay with everybody.
Works for me.
Excellent, outstanding. Hi, everyone. My name is Heidi Pfeiffer. I'm with the Centers for Disease Control in Atlanta, Georgia, coming to you from Atlanta, Georgia. Like I said a second ago, I really appreciate the opportunities to be on this, the opportunities to hear about the opportunities that are out there for people who are on this call to get your career started within public health. Well, the Centers for Disease Control, CDC, has a program called the Public Health Associate Program, which is very similar to many of the ones you've heard earlier before me. This one is with CDC, very similar as far as the mission. We want to work within public health. And if we can go to the next slide here, it really is the basic tenet of public health programming is to train and to give people the opportunity to be trained within early in their career in public health careers. We want you to stay within the public health workforce and make an impact towards public health. That's really basically all. And I say this with a smile on my face, that really is what Public Health Associate Program is all about, is really finding people who want to work within public health, people who want to make an impact and possibly work for a governmental agency. That is something that's a little bit different than, unlike New York City, of course, being a government agency as well, but this is working for the federal government. One of the things that we like to talk about here is that most public health happens at the local level. So the partners that we have working with us are people at the local level, like people like Janice and people at the health, like Jeffrey, agencies that are working within the public health field and might be actually be health departments or might be health agencies. So we have a partnership with these agencies that you actually get placed there, very similar to the positions we were talking about. Really quickly, what this is it's a 2-year paid field program. And when I say field, that means you're out in the field. What happens is we hire associates and we place them within health departments or NGOs. You hear the term NGOs, non-governmental agencies. Something like Jeffrey, the health care connection would be an example, is because it really truly is an agency that's a partnership with public health. And you're placed in there for 2 years. You are a federal employee, so you get all the federal employee benefits with insurance and 401k. But really, truly the biggest part about this is it is a partnership and it's a collaboration between us, the CDC, as well as the host sites. And it could be at the state level, it could be at the county level, it could be at the city level. We actually even have people located in tribal nations and also on our island friends outside of the United States. So we kind of go across the entire domestic range here within the United States. Well, what makes you eligible for this? Well, you have to be committed and passionate about public health. And I say that sincerely because public health is not, as we all know, the most highest paying jobs initially, but they are sometimes the most highest rewarding jobs you'll ever work in your entire life because you truly are making an impact and you're working with people. So we want to make sure that you're committed and passionate. Now, we also realize that that early in your career, just like myself, I didn't know what I wanted to be when I got big. So what we do is we talk to you a little bit about the programs that we have. We'll talk a second about where where we place you. But we want you to be passionate and committed. You have to be a US citizen or a permanent resident, have a degree within the last 2 years. So that means you can graduate, you can still be in school and apply for PHAP. You can wait a year, take a gap year and apply for PHAP. This could be either a bachelor's, which is what we would like, and then anyone who also gets a master's too. If you've got your master's, you want to be work within federal government with the PHAP program, you're also eligible for that as well. Our grade point average is 2.95, and again, it's on a 4.0 scale. And some of the commitments here that we have is you've got to be able to commute, to be able to relocate by yourself and at your own expense. Unfortunately, there are no relocation tuition reimbursement or relocation reimbursement or any type of funding available for us at the federal government to move you. However, we've got a lot of support. You might see a guest star on my presentation here in a second. My cat seems to not want to go off the desk here. So just in case, we might have a new person coming in. The program, as I said, was 2 years. So we want to make sure you're committed to do this for 2 years. And that is that. What are some examples of the assignments? Public health is pretty broad and it can be general at times. And these are just some topics that CDC works in. But as you can see, we work in all different arenas. What's nice about the Public Health Associate Program is that we ask you to be a generalist. And what that means is, even though you might want to work with an STD or work with maternal child health or even work with children, it doesn't guarantee you that that's the field you're going to be able to work in. What's nice about the Public Health Associate Program is we teach you, very similar to many of the other programs we heard about, is there's transferable skills that we teach you early on within your career that can be applied in STDs, that can be applied in immunizations, or can be applied within working within chronic disease or even injury health. So that's what's nice about this program is it's very generalist, but it gives you the actual skills that will make you transferable and actually hireable after the 2 years. Some of those skills I talked to you about are all fall within our competency domains. We have these are our domain main headers, and we have almost 75 different competencies, but a lot of them are listed within generally under communication, professionalism, public health funding. We teach you a little bit about how the funding happens within a government agency. You'll learn about the science of public health. You'll learn if you're working within injury control. You'll learn about seatbelt laws. If you're working with an STD, you're going to learn a little bit about gonorrhea, not a little bit, a lot about gonorrhea and chlamydia and all the STIs that go along with that. So one thing that we really want people to understand is that we're looking for people who really want to do and make an impact and do and work with people. Here's some examples of work that has happened recently. As we all know, we've all been through COVID together. A lot of our associates were deployed. CDC is a deploying agency. So even if you're in Virginia or you're in California or you're in New York City, it's possible you'll be deployed during an event or when there's something happening within that region. So you do get some opportunities to really network and meet and learn new skills. As you can see on the left-hand side, that's actually within LAX airport. That was a picture that I took when we were doing right before COVID started, when they were coming in from Wuhan, China, and you'll learn how to don and doff PPE. So these are all skills that we teach you. We don't expect you to master because you are in a training program, and this is something that we want you to nurture through your entire career. Well, how are you and who are you and who are our PHAP candidates? Well, best way to say it, it's the best fit, not the brightest, not the smartest. It's the best fit. And as you can see, if you use the acronym there, BEST and FIT, really looks at, we want people who can think big, okay, who can communicate, who are inclusive. We want to make sure that you understand you're going to be working with people you might not know, you might not be familiar with, might not have any experience with, might be different colors, different genders, different sexual orientations. So we want you to understand that you're going to be working in an arena that might be a little uncomfortable for you. But as long as you can thrive within those and you can really overachieve and really take the time to learn about how to deal with these populations, that's the kind of person we want. Flexible, i.e. when your presentation won't go into presentation mode, being flexible, because we want you to be able to pivot on a dime. You might not know what you're pivoting to or what you have to do, but you're going to pivot with a smile and say, okay, what do I need to do here? Intelligence, well, we want some intelligence. Of course, you all are within school and learning a second field. We want to make sure that we've got some type of intelligence, and that also falls along with critical thinking. We want you to be able to think critically. You know, what would you do in a situation where you don't have all the tools with you? You know, who do you do? What do you do? Who do you reach out to? And then also a tactile learner. I don't know about you, but I love doing things, as I think Jeff said too, doing and getting out there in the field really is how you learn. So this isn't all observing or shadowing, though there is many hours of that. But we do understand that after this 2 years, you're going to be able to do the job that you were hired for. But for those 2 years, you're supported not only by CDC within a CDC PHAP supervisor, but we also have mentors, and you have the whole agency, and you also have the entire program. People like myself that can support you during this time. These are all located within host site agencies. And as I mentioned earlier, the best fit is who we're looking for. So if you feel you fit this best fit, our application process is once a year. It's in January. And we've hired an average of about 150 people in the last 6 years. At one point, we actually hired 200 people. We started back in 2006 with 30. So we've evolved, ebbed and flowed, and really had to respond to what public health needs are within the communities as well as the nation. So this is just another example of a program that's available to you for public health and getting into the field. So I look forward to answering any questions, Tracy, that we have for the program.
Excellent. Thank you so much. All right. At this point, I'd love to bring back all of the panelists for Q&A. And I am going to put a couple of responses in the chat really fast that are out there. But also, I want to invite all the guests to put a question in the Q&A widget at the bottom of your screen. So one question that came up is where you can access this week's recordings, and so those are available on our website right here. And another question that came up about where you can find MPH programs, and we, the Association of Schools and Programs of Public Health, have a great resource for that. So I'm going to drop that link. It's the program finder, so you can use that to look for graduate schools. Okay. With that, we have everybody back. Thank you so much. Again, those were super informative, and always excited to hear about your programs. I know everybody has great experiences, all the students that I hear going through those programs. So a little bit about eligibility. Are any of your programs eligible for non-domestic students or international students?
Yeah, for HRTP and EPI scholars, we accept international students. You do have to work with your ISO, your international student office, just to make sure that you have all the CPT permissions that you need, and that you're able to accept the stipend if you're working on our EPI Scholar program, or if you've decided to come in and become an internship, but you must work with your ISO office. We are happy to provide a letter to the ISO office outlining the program and what you will do. But that's something that you will need to have, but you will be, if you're being paid, it's a little bit more complicated, but we do accept international students.
Thank you.
This is Heidi from CDC. My program, the Public Health Associate Program, we work only primarily with people who have U.S. citizenship or permanent residency, but there are other programs within CDC, other fellowships that do accept international students. So I'm going to try to find a link for you that I can put in somewhere, Tracy, while we answer the next questions, okay?
Great. There's also questions about which programs of study people need to have done, or if there's specific coursework. So do you all want to talk about if there's particular educational background that you're looking for?
Within Health Career Connection, people come from a wide range of educational backgrounds. We do like people who are public health or health science or health administration undergraduate majors, but we love also people who are, who are pre-med, people who might be working in data science and social sciences. But there's no one background that really is better than others. It's really you articulating your passion for working in the health field and getting more exposure and experience, and articulating the sort of the skills and lived experience that you bring to an internship, and then we work with you to see how that fits with what our employer partners are looking for to make a match. But we have people from all ranges of backgrounds, all social sciences, business, pre-law, policy, social welfare. So everyone's welcome. All of those are needed to improve health.
Hi, this is Heidi. I'll echo everything Jeff said. Our requirement is a bachelor's, and we like people that have bachelor's, because then what we can try to do is help guide them and look and find the fields of interest. We do take people with masters, but we don't want people that think this is where I need to be because I have a master's in public health or I have a biology degree. We want you to come with a degree that shows us that you've spent 4 years at a university. I supervised PHAP associates for a while, for about 8 years, and one of my best associates, I have to say, had a degree in, I think it was theater or dance. And you wonder, well, how could he have made it through the interviewing process? Well, I got to tell you something. He convinces people to do things because he acted so well, and his communication skills were outstanding. And he knew nothing about science. He didn't even know what a lab looked like. He had no background in public health whatsoever, but he knew he wanted to work in the field. And he also knew he wanted to work possibly in public health. And because of that openness and also flexibility, he walked in with his theater degree and his experience working as a Cub Scout and helping out people. And he now is a director of a program within Baton Rouge in Louisiana. So he's working in public health. So as far as requirements, it's a bachelor's within CDC. Other fellowships, I'll send Tracy that link for you. But in some cases, you can't get into these fellowships right away. We'll take people with masters. We'll take people with PhDs as well. And I'm sorry, my cat will not leave the screen.
We love her.
Let me jump in. As far as SHPEP goes, we're specific to college freshmen and sophomore students, right? One thing I like to say as far as like the type of student we like to look for is, someone who likes to help people. I think when you go into a career in the health professions, that's a critical component, and just being selfless and understanding like the different types of patients and different types of people, being open to different diverse cultures as well. I think those are really big pieces of all of this. As far as, since we are college freshmen and sophomore students, I like to call it an exploratory program. Even if you're not sure on what you want to do, that's fine. Our program, as you go through, or maybe you have a sense, like maybe, you participate in our program thinking that you want to go and be a doctor, but then all of a sudden, after you complete the program, you're like, hey, you know what, let me go into public health or let me go into dentistry. I think the fact that we're able to explore different health professions really allows the students to really make more sound decisions as far as like their career trajectory.
And we're a hybrid. We take all majors. Public health majors are great. And if you have a specific concentration in biostatistics or epidemiology or surveillance, that's great for our Epi Scholars program. But the other programs are a little bit more general, except for the preventive medicine programs, which of course you must be a medical student or have graduated from medical school, be a resident for our PMR program, or be in medical school for our elective program.
Great, thank you. I do want to reiterate that there was a question in here specifically about transitioning from chemical engineering to public health. Again, public health is so interdisciplinary and we need everybody, and those are definitely skills that you will be able to bring to the table and make a difference in public health. So whatever your background, we are here to help you make an impact in this world.
Right. Just to add to, I'm sorry, to add to that, Tracy, I always, when I meet students, I say you could be a basket weaving major as long as it makes sense, right? If I say I'm a basket weaving major, but I believe that if we all, learn to weave baskets, we can reduce our health, we can reduce our chronic stress, and chronic stress causes so many diseases. But however, through my basket weaving degree, I would like to teach everyone to weave baskets and reduce stress and improve our health in a community.
Absolutely.
Just make it make sense.
I would agree. I would also encourage you to look at the public health competencies. There's something called the Council on Linkage between academia and practice, public health competencies, and then to be able to tell the story about how you and your background align with like what competencies you developed and what experience you bring from your background, which would be substantial. So just be able to tell that story.
And I'll jump on what Jeff was just saying. Even people who have law degrees, we need them in public health. People with environmental and even science degrees, like as the example you shared, Tracy, we have a field within emergency preparedness. We need to know about chemical agents. We need to know about how chemicals affect people, their bodies. You might not want to work within that part of the field, but we definitely need all specialties within public health. And public really truly is public as well as the population, the whole health of the public.
Great. Thank
May
you.
I just add something also, Tracy?
Absolutely.
Just to go back to the
Yeah.
video that Tony showed regarding the student saying about the personal statement, all of that comes together nicely in the personal statement where you put the steps together and you make that chain make sense.
I love that. That is great advice. So there's a few questions in here about timing for the application. A couple specifically about CDC, like can you still apply for this fall? So Heidi, can I start with you to talk about your timeline for the PHAP program, but I'd love everybody to reinforce what your timeline is.
Sure, our timeline starts in January. The application process is only open for 1 week. And I say this sincerely, we don't do any type of recruitment because we get thousands of applicants. However, what I want you to know is that because we are the government, it does take a little while for us to go, not necessarily go through all the applications, but go through all the systems that these applications then bring, is that your start date would be October of that year. For example, if you would like to be in the class for 2024, it opens up in January of next year, and then you would start October of 2024.
I saw some question about fall opportunities for recent graduates. And so Healthcare Connection, most of our applications are in the fall for the following summer. But there is a chance, and it does look like we will have some fall internships through HCC. And if so, we may or even year-round opportunities, then we can post those on our website. We can send it to Tracy, who can send it out to her network so folks would be aware of it.
As far as for SHPEP, our application will open in the fall as well, at specifically November 1st. The deadline for the fall's application for next summer was going to be February 5th. And then after that, decisions are typically released March 15th. So annually, it's the same schedule, just to kind of make things easier for students.
And for HRTP, we have a summer application period. We have a fall application period. We have a spring application period. So there are 3 opportunities for folks to participate in the program. Our next application period is July 15th to August 15th, and that's for fall 2023.
Excellent. Definitely dates to put on everybody's calendars. All right, we are wrapping up with time. I don't know if there's one last thing you want to share with everybody before we close. Tip or thing you wanted to let people know, that'd be great.
So I'm just looking at the Q&A and I saw the question, someone about what programs are available for non-students, especially years after graduation. Here at the New York City Health Department, we take volunteers. We have a volunteer program, so you can, and I don't know where you're located, but think about connecting to your local public health organization and seeing how you can volunteer to get some of the skills or to use some of the skills that you have and then learn some of the newer skills and put them all together if that's the route you think that's right for you. And I think my last words is public health is ready and available to anyone, and we love everyone. And so why would you do anything else?
Exactly. Thank you.
I echo that, and also don't select yourself out of applying any of these programs. If you don't apply, the answer is for sure you're not going to get in. So put your best foot forward to apply to these programs and also the schools and that you want to go to as well. And yeah, we need you, and be able to articulate what you're passionate about and what you want to do, aligns with the mission of public health. And and please fully go for it.
I will comment
Amazing, thank you.
exactly what Janice and Jeff said is you can't win anything unless you're in it. So definitely apply. Even these programs can show you what you don't want to do. It's possible that you'll get into a program and be like, I really don't like environmental health, or I don't like working policy. I like working with people. I like working with adolescents or adults. It really is about self-exploration, and all these programs support not just jobs, not just interns, but we support the learner and the person. So we really want you to be able to get your feet wet, like it, not like it, figure out where I want to go, what hole to go this way, what way to go this way, because that's what this is all about, is exploring and figuring out what I want to be in public health. If you were to ask me what I did when I first started 25 years ago, it definitely was not this. I was a public health nurse, handing out milk cartons at a school, trying to convince kids to drink milk and eat their broccoli. So it changes and I evolve, but that's what happens when in public health, you evolve within your career.
You know, I just dropped a link in the chat for everyone to kind of see, but on our website, if you go to shpep.org and you go to for students, we have an other opportunities section where you can find, you know, any type of opportunities to gain experience, even ranging from like kindergarten all the way up to like, you know, graduate school. So definitely check those out for sure.
This is amazing advice. Thank you all. Every time I listen to you, I learn something new. So I really appreciate your time and sharing these fantastic programs with our students. Have a great afternoon, and hopefully we will see some of you on our webinar tomorrow, 40 Under 40 Careers in Public Health, featuring the DeBomat 40 Under 40 in Public Health awardees. And also we have a group of mini fairs coming up. So if you want to learn more about grad fairs, that's coming up as well throughout April. Okay, thank you all. Have a great day.